Hi, everyone. I'm Dr. Erin, and this is the Trial Site News podcast. And today we're going to be talking about the COVID-19 situation in Israel. Our guest is Dr. Ariel Israel, who is a doctor and a researcher there. For background, we know that Israel is a highly vaccinated nation. They use the Pfizer vaccine, and they seem to have a lot of things under control for a while, but then we saw case numbers starting to go up and hospitalizations, that kind of thing. So today, Dr. Israel, thank you so much for joining us. It's a pleasure to have you. And to start, I suppose, I know you wrote two recent studies on the Pfizer vaccine. So can you tell us a little bit about the first one, which is the elapsed time since the Pfizer vaccine risk of COVID-19 infection in a large cohort of people?
Yes, of course. In this paper, we tried to understand the reason behind the recent rise in infection numbers that we've seen in Israel. As you've pointed out, Israel was among the first countries to vaccinate all its population. We had more than 80% of our population who were vaccinated exclusively with the Pfizer vaccine, and we went back to normal quite early. In February, we began opening gathering again, and we thought that the COVID pandemic was behind us. And beginning in mid-July, we saw a very rapid increase in the number of COVID cases, which happened also at a time where COVID-19 dominant variant was the Delta strain. And so it could be either because the vaccine was not protecting enough against the Delta variant, or because there was a waning effect from the vaccine. And that's what we tried to assess. We looked at our patients in our health organizations who had been vaccinated and who contracted COVID-19 since May 15th. And we found that there was a much greater proportion of infections among people who got vaccinated more than the median time, which was, when we looked at the data, was 146 days, 4 days less than 5 months. And so the odds ratio for getting the virus was significantly higher among people who got vaccinated more than 5 months ago. And so this led us to understand that there was a significant effect of decreased protection provided by the vaccine. And that's what the paper shows. It shows it in each age group separately, because when the vaccine campaign was rolled out, we began by vaccinating people who were age 16 or more, and then 50 or more, and 40. So what we did is considering the same age groups, and in each age group we found that there was a significantly higher risk of getting the virus for those who were vaccinated more than the median time.
So that's interesting. So there was no significant differences among the age groups.
There were significant differences among the age group. Inside each age group, there was a significant difference.
Okay.
Between those vaccinated early and those that were freshly vaccinated. And of course, there are differences also between age groups. We know that the more people are aged, the weaker are their immune system. And of course, the difference was also higher in the between freshly vaccinated and vaccinated more than 5 months. Was even higher among the individuals that are aged more than 60s and among younger individuals.
And can you discuss, I know you just had a paper, it's in preprint, and that talks about the difference in antibody titers between people who had COVID-19 and recovered and people who are vaccinated and have antibodies induced from vaccination. So what did you find in that study?
So yeah, that's a complementary study because it provides an explanation about the finding that the vaccine is decreasing in effectiveness. In fact, we looked at the serology, at the IgG antibodies against SARS-CoV-2, and we found that first, when we look at the antibody titer among people who got freshly vaccinated, they received 2 shots of the vaccine. They have higher antibody titers than people who recovered from the virus. It's about 10,000 AU per milliliter, and among people who got the virus, it's about 1,000 in the average. But when we look month after month, we found that among people who got vaccinated by 2 shots, there is an average decrease of about 40% each month. So it means we begin with 10,000, the month after it's an average of 6,000, and it goes decreasing and decreasing. On the other hand, when you look at the population of people who recovered from the virus, first we see that in the first 3 months, it's slightly increasing, meaning that the immune response is building up even after the person has recovered from the virus. And then it's decreasing, but very slowly. Antibody titers are decreasing by about 5% every month. So if we look at what happens with people who got vaccinated 6 months ago, we get a higher proportion of individuals that are below the threshold for detection for protection, which is about 50 AU per milliliter among people who got vaccinated. This percentage is higher than people who got the virus 9 months ago. So yes, it seems that there is a waning effect of the immune response, at least at the level of antibodies, like we measured with the Abbott kit.
So I have a 2-part question here. A lot of people think we should talk more about natural immunity and, the immune response that our body creates after being exposed to a virus or becoming sick. Should we consider that in our herd immunity equation, so to speak?
Okay, of course, what we found is that getting infected by the virus provides you protection, okay, for sure. And this protection on the long run is higher than the protection provided by 2 shots of the vaccine, of the Pfizer vaccine. But on the other hand, of course, you've got to consider also the risks that are associated with getting the virus. So we know in Israel we've got a population of about 8 to 9 million, and we've got already 1 million for which we have evidence that they have been infected with the virus. We have a positive PCR for them, and of course these populations do have some natural protection. What I can say from our data is that the natural protection provided by getting a vaccine after getting infected is even stronger than the protection that is provided by getting infected alone. So even for people who got the virus and recovered from the virus, there is some added value from getting at least 1 shot of the vaccine. And people who do not get the vaccine take the risk of, if they contract the virus, they can have a severe disease, and people die from this virus. So it's there are some risks.
Sure. My second question, so when you're talking about antibody production, how protective is that? We hear a lot about in the news or on Twitter, social media, people talk about, oh, it's the T cells that matter. But in your opinion, what difference does this difference in antibodies make? How protective are they? How reliable is this for people? Just an average person out there, like, well, my antibodies are pretty high right now, and then somebody says, well, what about your T cells? And then they're like, huh? So yeah.
So this for sure, the antibodies that are circulating in the blood are only part of the immune response. And as you pointed out, T cells are also important. The T cells are much more difficult to assay and to measure. So it's very difficult to evaluate how longing is this immune response. What we can say is that antibodies are the first line. Circulating antibody in the blood, if they are present in sufficient numbers, they can neutralize the virus even before it can infect enough cells to begin reproducing in the body. So for sure, there is some value about getting in the circulating antibodies that we are measuring. And so I think it's a first line and it's important. And also what we see by correlating the results we got from the second paper with the results from the first paper, which are clinical observation about people who got positive PCR for the virus, we see consistent results. So probably the antibodies are telling us something that we should take care of. Yeah. Also, what I want to tell you is that because of these results in Israel, the health authorities have decided to begin giving us a third shot for all the population almost. We began with people aged 60 or more and people who are at risk for severe disease. And now we offer the vaccine for all subjects that are more than 30 years old. So and I think that we are beginning to see the numbers curbing. It's very early. It's just in the 2 last days, but apparently this is what would enable us to curb this wave.
I have a question about boosters, but first I wanted to ask you a question that a lot of people have, particularly about Israel. They're saying over here, the vaccines, well, you might still be able to transmit if you're vaccinated, you'll be infected less. However, it significantly decreases your chances of severe illness and being hospitalized. Is that what you're seeing in the hospitals in Israel, that the vaccine is protective of that?
That's certainly true. So Iman, if we look at the breakthrough infections that happen in people who got vaccinated, the percentage of severe disease requiring hospitalization and the percentage of mortality is much decreased compared to people who did not receive the vaccine at all, even if we match for age and for risk factors. But this risk, even if it's decreased in people who got the vaccine, is not nil, is not zero. We've got about 500 people died since the last month and a half in Israel, and a great number of them had received the vaccine. So even though we think that two shots provide some protection, we think that it's waning in time, and we need a booster in order to avoid severe cases.
And can you talk a little bit about children? A lot of people are concerned about kids going back to school. Obviously, there's some kids who aren't eligible below the age of 12 who aren't eligible for vaccine. Are you seeing an increased hospitalization in kids because of the Delta variant?
It's difficult to say. I don't think we see an increase in hospitalization of children. We have a very significant increase in the hospitalization of adults, and in particular populations that are at risk, people who are overweight, people who got diabetes, people who got hypertension, people who got conditions that are associated with the decreased immune response. With children, I don't think we can say that there is a significant increase, but of course, the more people carry the virus and can transmit it to children, the more risk we have to see children that would contract a severe disease. So by taking care of the adult population, in some way, we are also decreasing the risk for children, because in most cases, I think the source of infection is an adult who can transmit it to children. But if we can decrease the numbers of cases in adults, we will take care indirectly of children. And in Israel, we also provide vaccination. Children aged 12 or more can already receive the vaccine, and it's every patient's decision. But we see a great numbers of children who choose to have the vaccine.
How would you advise a parent who is concerned about giving their child this vaccine? And a lot of them have legitimate concerns. These are new vaccines. They use messenger RNA. We haven't used that before in a massive vaccination campaign. So I think it's important to acknowledge their concerns, especially in children where, you just said, it seems like it's low risk. We're not seeing an increase in hospitalizations or deaths. I think I read UK data that is similar. So how would you advise a parent who said, well, I don't know, should I give my child this vaccine or shouldn't I?
What I can say from what I see around me and from what I've read like you is that the vaccine is probably safe, very probably much safer than getting the virus, even in children. They've chosen the age of 12 and to give the vaccine. I think the main reason why parents in Israel give the vaccine for children is not that they are afraid they will get a severe disease, but they just want to get back to normal, not to have to worry about their children getting the virus every time they meet friends, and to send them to camps and everything. So I think also there is some value of being quiet and knowing that your child will not get the virus. The numbers that we are seeing is that the vaccine is probably much safer than getting infected with COVID, even for children.
I have a question about boosters, and I wanted to go back to the phrase that you just used, which is getting back to normal. And like Israel, you had a successful vaccination campaign, meaning a lot of people got the vaccine and everyone was, whoa, we're going to get back to normal. Same thing in the US. A lot of the phrases we use to encourage vaccination was, we'll get back to normal, get back to doing the things you love again. And that really didn't happen. They told us to, if you're fully vaccinated, you can remove your face mask, but then we had to put it back on again when they realized that even if you're fully vaccinated, you can transmit the Delta variant, and it's very infectious. It has a high reproductive number. So then they said boosters, and as you mentioned, Israel is giving out booster shots, and I think we're going to give them out too. The president has made that clear. But people are concerned. What data is that decision being made off of? And again, especially for the younger population that is at a lower risk of dying or succumbing to this disease, and the older populations. And why should they take this third booster, which is is identical. It's an identical shot to the first two. It's not, they didn't manipulate the messenger RNA to create some kind of different spike protein. But we have the Delta variant, which is a different variant than the Alpha variant. So how do we know we're not going to just sort of be playing this sort of game of cat and mouse?
So you have some luck in the US that you have Israel behind you. So we are ahead of you a few months so we are now experimenting what happens with the third shot, and we will we'll give you the results of our real world experimentation that we are doing here. So far, I can tell you that it appears that the third shot is quite safe. I don't see, and personally I received it, it didn't get sick from it. And I don't think that there is adverse effects more than the second one. And I'm really curious myself, what will happen in 6 months from now? Will we have to have a fourth shot, or the third shot will prove to get a longer lasting immune response? It's too early to say. I think we are learning every day about the virus, about the vaccine, about the adverse effects from the vaccine, and the complications from the virus. So far, it appears that the vaccine is much safer than getting infected with COVID for most of the people. It's especially true for for aged persons who are at high risk of complications from getting the COVID. And we are trying to do our best to interpret the results and take the right decisions. And of course, we'll have to adjust with what we will learn in a few months about what have happened with the third shot, and we'll keep you updated.
Well, I appreciate your honesty there, because lots of times experts come on and they're, like, this is the answer, this is how it's going to be. There's so much uncertainty here. Yeah. And we just don't know. So I think sometimes, especially experts do a bad job communicating that uncertainty, but people have a right to know, we don't know for sure. So I definitely appreciate that answer. My final question is, have you guys been looking into early treatment at all? A lot of people over here always talk about, cost-effective medicines, even repurposed medicines that we can use, we can try. And if we really, we're trying this booster, we're trying this out, why are we not trying early care?
I certainly believe in that. And I published another paper that I recommend you to look at it. It has been published in eLife, and it's an observational study that we performed in Clalit, which is another HMO, and in which we looked at all the injuries and the medications that they have purchased 3 months before the index date, before they did the test for COVID. And we found a few medications that apparently provide protection from severe disease. And they are listed in the paper, like vitamin D, rosuvastatin, ezetimibe, magnesium, calcium, zinc, azithromycin. There are a few medications, and I particularly recommend not the medications, but the food supplements like ubiquinone, which is also called the coenzyme Q, which are very safe. They are present in food, and we found that people who with vitamin B12 also, so they are present in food. I think they are safe, and people who contract the virus are safer taking them. So I will recommend to anyone who is at risk or who have already contracted COVID-19 to take vitamin D, to take magnesium, to take zinc, vitamin B12, vitamin C. These are food supplements. You are safe taking them, and I strongly encourage people to take it. Yeah, there are also medications which appear to have some beneficial effect. So azithromycin, for instance, but these are medications, and they can, there are some risks associated with them. So I will be more careful giving them to people who are not at risk. But definitely, I think there is something to do in the field of early treatment.
Thank you. That's so interesting. I actually didn't read that paper, but I want to. And
I will send you.
yes,
you
and for the
link.
viewers, I will share the link in the description so you guys can access it too. That's very interesting. Dr. Israel, thank you so much for your time and sharing your expertise and all the work you do. I wish you guys well and hope you get out of this. And to all the viewers, thank you so much for joining. I hope you value this content. Let us know what you think in the comment section and consider subscribing if you haven't yet. But as always, thank you for watching.